From the time I was very young in elementary school, I thought I wanted to be a physician. I loved science, and growing up in Denver, my mom would take me to the Denver Museum of Natural History, and I would dissect sheep brains and fun stuff like that. But when I moved to Dexter, Michigan, we started to have relationships with some of the medical school professors. My mom is a piano teacher, so she would be teaching their children piano, and so then I started babysitting, and then eventually that led to I got a job in the research lab of one of the top plastic surgeons there at the plastic surgery department at University of Michigan Hospital. And that was amazing. That exposed me to the world of plastic surgery in the sense of reconstruction, skin cancer reconstruction, the importance of symmetrical facial movement. I actually did a research project in the importance of recovering symmetry in a person's facial movement after surgery. And that was in early college, and I would come home and do research on that in the summers at University of Michigan. And that really sparked my love of, I believe, what would eventually lead me to become a dermatologist. Skin cancer, the appearance of one's skin, the appearance of one's face, how important that was in someone's self-esteem, and an enjoyment of cutaneous surgery, essentially. I feel very honored to have been able to train at University of Michigan. It's a world-class institution. The dermatology residency is one of the top 5, and we trained in a multidisciplinary melanoma clinic where we worked with surgical oncologists, pathologists, dermatologists, radiation oncologists, taking care of each melanoma patient. We saw very rare skin cancers, things like Merkel cell carcinoma, which a lot of people don't have the chance to learn how to take care of. We trained in sort of more unusual skin diseases, things like autoimmune blistering diseases, severe cases of psoriasis, where we actually had an inpatient unit where people would come in, stay, get light treatment for 2 weeks, wear a sweatsuit, all their psoriasis would melt away. It's pretty cool. So it was just an amazing training experience, and at the end of that 4 years of dermatology, I had planned to go into private practice, and my husband and I were just kind of looking at a map of the US and thinking, where could we go that's a little warmer, kind of tired of the winter. My husband grew up in Cuba, actually, so he was very cold by the end of 8 years in Michigan. And we thought Charlotte looked like a beautiful place to live. And so we just took a leap of faith and moved here. We didn't have any family here or anything. My passion is to be a medical doctor. I want to help patients. I want to focus on the patient experience. The Mooresville Dermatology Center was born in 2010. Just myself practicing as the only dermatologist. We quickly had a lot of patients, and so about a year later, I hired a PA, Kristen Prohaska, who is an outstanding dermatology PA. I think one of the best in the Carolinas. And she and I practiced together for about 3 years, again, got extremely busy. We're having a hard time getting patients in on time, and felt like we really need to hire a partner. So at that point, it was very fortuitous. I got a phone call from University of Michigan Dermatology saying, hey, we have this great resident, Scott Paviol, who's looking for a job in the Carolinas. He's a terrific guy, and would you be able to maybe help him find a job? So he and his then fiance came down, and we met, and they're just wonderful people, had instant rapport, and he loved this area, and we decided he would be a great fit for Mooresville Dermatology practice. So I feel very blessed to have Scott and Heather Paviol part of the group here. And then within the last year, Dr. Paviol actually hired another PA, Lauren, who's also fantastic, grew up right here in Mooresville. So we have 4 wonderful providers now. So it's just, it's been an amazing journey. In the office, we do things like mole removals. We remove a lot of what we call atypical moles, or moles that are precancerous here. Sometimes we remove moles if they're large and the person may have trouble monitoring them, like they're on the lower back or a place where it's just not going to be easy to check for signs of melanoma over that person's whole lifetime. They'd rather have the mole just removed. We also remove superficial skin cancers like thin basal cell carcinomas, squamous cell carcinomas, and thin melanomas here in the office. We also have a very close network of experts in skin surgery that we work closely with all over the state of North Carolina. We have Mohs surgeons that we know personally that we refer lots of patients to, everywhere from Hickory to Salisbury to downtown Charlotte. We can call the surgeon on their cell phone and say, this patient's coming in, this is what's going on with this patient. The digital photos on the way to your office, and they will take fantastic care of our patients. We have excellent general surgeons, excellent colorectal surgeons, excellent laser surgeons that we can refer patients to. So we really have a whole network of other skincare specialists that we feel comfortable that we would send our own mom or dad to. We also do practice some cosmetic dermatology, which we really enjoy because it helps people feel better about themselves, feel better about the aging process. Our patients are not the ones that want to come in and look like Kim Kardashian. Our patients are the ones that want to come in and look like a refreshed version of themselves. And that's what we love to do. We do everything from chemical peels to microdermabrasion to Juvederm, Botox, Miradry, which is the non-invasive treatment for underarm sweat. The great thing about coming to a board-certified dermatologist for that is that if you're having a cosmetic treatment done by one of us and we see a skin cancer on your face when we're doing your lip rejuvenation, we'll say, hey, I think you need to get that biopsied and come back tomorrow and we'll biopsy it. That's actually happened to me before. So it's good to have somebody who knows skin doing your skincare treatment. And so we're basically a comprehensive skincare center here. What people are going to get when they come to this office is doctors who truly care about the patient. We spend the whole visit talking to and looking at the patient. We don't turn our back and type on the computer for the whole visit. We've actually trained our staff to do that part of the visit so that we specifically can focus on the patient, the doctor-patient connection, which we really value and we feel makes a big difference in your care. We want to be your partners in your skincare, so we're not here to just kind of tell you what to do. We're here to tell you what your options are, from changing your diet to taking a strong medication, and really kind of help you decide what you want to do to help heal your skin. And we treat our staff and our patients like family. So we care about everybody who walks in the door. We're going to send, if we have to send you to another doctor, we're going to send you to the person that we would send our mom or dad to. And we just enjoy having a great office, coming to work, loving our job, enjoying taking care of our patients. It's a great life.